Welcome to this special talk on Old Cities Day. This day serves as a reminder for us to actively engage in the discussion regarding the challenges and opportunities arising from rapid changes in our cities and towns. Today we'll discuss urban health concerns and explore how urban health research can contribute to strengthening urban health systems in response to emerging health needs in the cities. Our guest for this conversation is Helen Elsey, a professor in the global health at the University of York in the UK. She also serves as the co-director for poorest Research Consortium, which stands for Community-Led Responsive and Effective Urban Health Systems, and is implemented in Bangladesh, Nepal, Ghana, and Nigeria. Welcome, Professor Helen. How have you been, and what has been keeping you busy lately?
Thank you, Shriman. It's really great to be talking to you today and to be able to have this conversation about Urban October. I think it's really, really important, and now more than ever, so that we know that by 2050, almost 70% of the world's population will be urban. And some of the most rapidly urbanizing cities are in South Asia and Sub-Saharan Africa, which is exactly where our poorest program is working in Bangladesh, in Nepal, in Nigeria, and in Ghana. So it's within these contexts that we really have to start understanding urbanization. And I think for many years there's been a focus on rural health and improving health in rural areas. And this is absolutely right. It's still low health outcomes, poor health outcomes for many people living in particularly really remote rural areas. So those needs are still there. But what we've seen over the last 20 years, really, the rapid urbanization and the impact that has had on health systems is really remarkable, and it has raised a lot of challenges for the health service to deal with, but also real changes in terms of people's lifestyle and how they're living in cities, and subsequently the impact on the disease burden. So we have to start understanding not only what's driving poor health in cities, but also what we can do about it in terms of prevention, but also in terms of the healthcare system, how we try and organise that system within cities, so we can achieve universal health coverage.
As we are aware, rapid urbanization has become a prominent global phenomenon. Cities have become home for people from every walk of life, regardless of their economic status, profession, class, or gender. Could you please share your insights on the implication of urbanization on people's health?
Yeah, and I think it's absolutely crucial that in Urban October we focus on the poorest residents in cities. They are particularly vulnerable. Many studies have shown that new migrants, so people who've just arrived in the city, are really vulnerable. They struggle to know how to access health services. The high number of people that are working in the informal sector, and that may be different. You might have very different experience if you're male or female or third gender, but the kind of intersection of those characteristics can lead to a kind of coming together of all the challenges into a much greater problem than maybe some of those characteristics would create on their own. So for example, it can be really hard for a female daily wage earner within an informal settlement, and she might face even more challenges than maybe a male daily wage labourer in a similar context, or someone with disabilities might face even higher levels of challenges in those settings. So it's about understanding how all those characteristics might come together to really increase the challenges in terms of finding healthcare, but also the impact on your own health. So this has been really key, and some of the issues that we've explored. So for example, the team in ARC Foundation in Bangladesh did some really detailed qualitative work with the transgender community in Dhaka, and they were looking at healthcare seeking behaviour. And what came out of those interviews was a really detailed understanding of the discrimination that people of the third gender experience when they're trying to access primary care. And not just from health workers, but even just sitting in the waiting room. There are some really insightful qualitative interviews that have just showed how even just the interactions with others in the waiting room can really highlight the kind of discrimination they're feeling on a daily basis. So that basically their only access to care will be maybe one pharmacist who happens to be more friendly towards them, and that's the only place they can go. So I think really trying to understand these different vulnerabilities of different groups with these sort of overlapping characteristics can really help us understand the challenges people face in accessing healthcare and looking after their own health. And they're under a lot of strain and stress, and this can have very detrimental impacts on their health and their treatment of any health conditions that they have. So we know that new migrants are a major issue within cities, and the focus on urban poverty is absolutely crucial. So there are many studies that have shown that within cities, the data that we have from, for example, surveys, even sometimes from the census, does not necessarily include some of the urban poorest population. So we may not even have the information about the urban poorest. So I think in Urban October, if we can really get that focus on inequalities within cities, targeting and understanding the needs of the urban poor, I think that would be a fantastic focus for all of us in policy, practice and research.
So, considering your role as the co-director for CORUS, an urban health research consortium from Bangladesh, Ghana, Nigeria, Nepal and UK, could you please provide us with an overview of this research initiative?
So, trying to understand urban poverty and find ways of strengthening health systems so they can respond to the needs of the urban poor is really the key aim of CORUS. So in CORUS we have partners from research organisations in 4 countries. So we work with the University of Ghana, University of Nigeria, and in Bangladesh it's the ARC Foundation and the JPG School of Public Health in BRAC, and in Nepal it's Herd International. So all of our partners have long experience of working with the health systems in their countries, and also have experience of working in urban contexts. So building on all that expertise, CORUS has then taken this a step further to really explore how we can strengthen health systems within the urban context to meet the needs of the urban poor. And so within CORUS we have 4 main pillars of our work. So the first one is all about trying to understand all the different providers of health services within the city, so the public sector and the private sector. So our second pillar in CORUS is all about how you try to work across different sectors. So maybe it's working with on water and sanitation, or maybe it's on working on crime. So we have projects in CORUS. We have a scheme called the Innovation Fund for Early Career Researchers. And in Nigeria, we have early career researchers looking at the impact of crime on people's health in informal settlements in Nigeria. And in Ghana, we have people looking at water and sanitation within cities. So this is a core pillar for us in CORUS. And then the third pillar is all about the, so we still have communicable diseases, but to add to that, there's this very sharp increase in non-communicable diseases. So hypertension and diabetes in particular, and that is so apparent in South Asia in particular. So a core pillar for CORUS's work is to support healthcare systems to address diabetes and hypertension, as well as having to deal with all of those communicable diseases. So our projects in CORUS in Bangladesh and also in Nepal have a real focus on diabetes and hypertension and supporting primary care to respond to those conditions, and drawing on, for example, the WHO PEN package to improve care within the primary care sector. And the final pillar, and the one that kind of underpins everything, is ways of engaging the urban poor. So this could be about looking at data and understanding how we get more data from the urban poor so that decision makers in local government can use that data to make decisions about how to better reach urban poor. So we have a number of projects across all the countries, but all of them are in some way tied to each of those pillars.
Thank you, Helen, for providing us with a comprehensive introduction of CHORUS. Could you also elaborate on the types of the evidences emerging from different countries that are proving valuable in strengthening urban health systems in the cities where CHORUS is active?
Yeah, absolutely. So within CHORUS, all of our partners have been doing really detailed needs assessments of the health facilities, particularly primary care, and in some cases the private providers and the informal providers. So what has come out of those needs assessments is really clear indication that people are, particularly within urban poor contexts, their first point of contact and the services they use the most are private sector. So here in Nepal, in Pokhara, where we're working, about 60% of providers are the private pharmacies, and that these are the first point of contact really for most people within the urban context. So this is a key finding, and it's amazingly consistent across all of the four areas. There are differences in the types of private provider. So for example, our team in Nigeria have done a lot of work with informal providers, which are really common within the informal settlements. So they've identified different types of informal providers, including traditional birth attendants, but also bone setters, patent medicine vendors, and herbalists. So they are then taking this evidence and all their now understanding of how people are using these informal providers to build a linkage between those informal providers and the primary care system. So they're now trying to co-design an intervention that will improve the quality of care and increase referral from those informal providers to the public sector. So that's a flavour of some of the issues that are really emerging from the needs assessment. So I think one thing I'd really like to say in relation to CHORUS is our research teams. So in each partner, we have fantastic researchers who are delivering really complex projects in the urban context, which, and I think this is really key considering it's Urban October, but trying to understand the complexity, and this is why we need research that really is conducted in urban areas because of this huge complexity. And we're seeing here in Nepal the different, with federalizations, the role of local government and how they navigate their role and try and build relationships with both health providers, public and private, but also other layers of government and across sectors. It's so complex, and our researchers are really working so closely with the different, whether it's local government or the providers, to understand those issues. And within CHORUS, we're really encouraging very embedded research. So here in Nepal, in Pokhara Metropolitan City, HERD actually have two researchers who are embedded within the PMC, the local government office, working with those workers at every step of the way, understanding their challenges. And because of that detailed understanding, it's really going to help us, or it is helping us in designing the kind of health systems interventions that we can do. So that embedded research is absolutely crucial to everything that CHORUS is doing, and is something that we're trying to do across every partner to make sure that our interventions actually really meet the needs. And also it means they will be more likely to be taken up once chorus ends. And our key aim is for sustainability and to actually strengthen the health systems during chorus's time, so it has that impact into the future.
Thank you, Helen, for taking us through urban health concerns and sharing insights into the initiatives of the Chorus Urban Health Research Consortium on the occasion of All Cities Day. Today we spoke with Professor Helen Elsey, expert in the global health at the University of York in the UK, as part of our engagement in the discussion about urban health during Urban October. Thank you for joining us.